Jai Gurudev. Myself, Dr. Sajida K, Professor, HOD, Department of Swasthavrita. Swasthavrita deals with the subject of preventive as well as community medicine. Prevention, what we are doing here in hospital, either reoccurrence of the same infection or the manifestation of a new disease at various levels of prevention. Means if some group is belonging to the high risk category, we will segregate them and will do the lifestyle modification in such a way how we can protect them from the complete manifestation of a life threatening condition. Whereas secondary and tertiary levels of prevention mainly meant for the treatment aspect. I mean, diagnosis of the case at the earliest and the proper selection of the treatment. Here, we are using a holistic way of approach, especially a combined treatment we used to do inclusive yoga to enhance the mental power of the person as well as the meditation. Along with that, the Ayurvedic modalities of Shodhana Chikitsa as well as the Shamana therapy we are doing here. Yoga and naturopathy is a subunit of our department which goes in such a way the patient, irrespective of their condition, if physically fit to do the yoga and the patient is willing, we teaches yoga for them for the further avoidance of the disease. Moreover, many a time certain diseases which we doctors used to consider as psychosomatic, for example hypertension, diabetes as well as skin disease. Skin diseases are coming purely under our department. So here we observed that a combined treatment with meditation and yoga is really doing wonder along with Shodhana as well as the Shamana therapy. Shodhana in terms of selected seasons are there for conduction of the Vamana, Virechana and the Vasti Chikitsa. It can act as a primary level of prevention as well as the secondary. Up to certain extent it will work in such a way. Moreover, a separate hair and skin clinic. I am not saying it is beauty clinic, it is hair and skin care clinic. In such a way, we are not at all using any sort of chemicals, purely herbal combination and Ayurvedic products we are using to improve the skin's texture, delaying aging as well as the health care. I am not saying just external application, even we used to advise certain diet modification for such cases. And a unique way of facial which is called as Panchatattva facial. Here purely we are using the clinically proven combination to reduce the wrinkles as well as even to close the pores, which is an unavoidable one when the aging is happening. Along with that, certain diet modification is also will be there. Then along with that, we are advising special lifestyle modification even for those people to improve the skin texture as well as the hair's health. Then another unit which is related to this is the naturopathy, which again will come under two heading. One is personal development, I mean personal hygiene as well as to avoid a disease for an individual, as well as we are doing the preventive modality of the further manifestation as well as curative aspect is going on for the various diseases by providing or by choosing the naturopathy modality. Diet is another part of the community medicine. Diet and mainly nutritional dietetics as well as therapeutic dietetics. Nutritional dietetics, overall improvement. Therapeutic dietetics is nothing but selective diseases. We are giving the special set of diet, which will go very well. I am proudly saying that the concept of Ayurveda is going very well, especially in case of the dietetics, even in newly emerged diseases like the diabetes and all. Then for a healthy individual, even for upgrading his own health, we have certain sets of modality which is explained in our science as Dinacharya and the Ritucharya. Dinacharya is nothing but daily regime, whereas Ritucharya is when the season is getting changed, how one can avoid unexpected disease manifestation. Under this category of Ritucharya, we can even think about, especially in case of psoriasis, if it is repeatedly happening, the Ritu Anusara Shodhana means we are expecting in dry climate, definitely the disease will aggravate. So prior to that, we will send the patient for a set of Shodhana or the detoxification therapy.